The following educational video was created in collaboration with the Faculty of Biomedical Engineering of the Czech Technical University in Prague and the First Surgical Clinic of the General University Hospital. Insulin administration. Insulin, a key peptide hormone, allows cell structures to absorb glucose and regulates blood sugar levels. It is administered to patients with diabetes. For optimal effect, it is crucial that insulin is injected into the subcutaneous fatty tissue subcutaneously and not into the muscle beneath it. Injecting insulin into muscle tissue can cause severe hypoglycemia. For adults, the injection sites should be spaced at least 1 centimeter apart to avoid frequent injections in so-called favorite sites, which can lead to changes in fatty tissue, lipodystrophy. Lipoatrophy refers to the loss of subcutaneous tissue, while lipohypertrophy refers to the formation of subcutaneous nodules made of fatty tissue. The primary method of prevention is rotating injection sites. The absorption rate of insulin is influenced by the injection site, blood flow to the tissue, and temperature. Insulin is absorbed the fastest in the abdomen, followed by the arms and thighs, and the slowest in the buttocks. Increased body blood flow, such as due to fever, physical activity, sauna use, sunbathing, massaging the injection site, or alcohol consumption, can increase the effectiveness of insulin. Conversely, a thick layer of subcutaneous fat and exposure to cold environments slow down absorption. Injection sites are also chosen based on the type of insulin and the current blood glucose level. Insulin is considered a high-risk medication and must be stored separately from other medications. All insulin packaging, whether unopened, partially used, or insulin pens, must be protected from light. Opened insulin packages should be properly labeled with the date of first use and stored at room temperature between 5 degrees C and 25 degrees C. Unopened insulin packaging should be stored between 2 degrees CC and 8 degrees CC. Before administering insulin, a blood sample is taken from the patient's fingertip to measure the blood glucose level, glycemia. Based on the measured value, the appropriate insulin dose is prescribed by the doctor. Normal fasting blood glucose levels from capillary blood are typically around 4.0 to 5.5 mmol/L (Bg-C). Before each injection, ensure that the insulin pen is ready for use according to the manufacturer's instructions. Cloudy or mixed insulin should be shaken according to the manufacturer's instructions by turning the vial upside down and rotating it. A new needle should be used for each injection. The needle is no longer sterile after its first use. Reusing needles carries several risks. After the first use, the needle becomes partially dull, making the injection more painful and increasing the risk of small injuries, bruises, and damage to the subcutaneous tissue. Injecting into hardened tissue can affect insulin absorption, leading to unexplained fluctuations in blood glucose levels. In such cases, it becomes difficult to calculate the insulin dose's effectiveness. Insulin may also crystallize inside the needle, potentially blocking it, which compromises the safe delivery of the insulin. There are various methods for single-dose injection. It can be done at a 90-degree angle without a skin fold, at a 90-degree angle without a skin fold, or at a 45-degree angle with a skin fold. The choice of injection technique depends on body type, type of insulin, and the length of the injection needle. For very thin individuals and children, a skin fold should be created even when using a short needle. Perform hygienic hand disinfection. Verify the patient's identification by asking their name and checking their identification label. Attach a needle to the insulin pen. Set the insulin dose to the precise amount, 0.5 or 1 unit, depending on the type of pen. Test the needle by expelling 1 unit to ensure the needle is clear. Disinfect the injection site. Inject the needle into the subcutaneous tissue, either with or without a skin fold at a 90-degree angle. Do not aspirate. Press the plunger on the insulin pen. Wait for 5 to 10 seconds to prevent insulin leakage from the skin. Apply a gauze pad to the injection site. Withdraw the needle from the skin and do not massage the injection site. A record of the medication administration will be made in the documentation with full identification. Insulin syringe injection. Insulin syringes are commonly used in hospitals for temporary insulin administration or for elderly patients who are accustomed to them and are unable to switch to insulin pens. A single-dose injection can be performed in several ways. It can be done at a 45-degree angle with a skin fold or at a 90-degree angle with a skin fold. Disinfect the stopper of the insulin vial, labeled with the date of first use. Draw insulin into the insulin syringe, leaving approximately 0.1 milliliters of air. Check the number of units drawn into the syringe. Disinfect the injection site. Create a skin fold with the non-dominant hand. Perform the injection at an angle of approximately 45 degrees. Release the skin fold and with the hand that was holding the fold, stabilize the syringe cone. With the other hand, aspirate. Slowly inject the insulin, including the air bubble. After the injection, wait for 10 seconds. Place a gauze pad on the injection site. We remove the needle. Wipe the injection site with the gauze. We clean up the equipment, dispose of the insulin syringe in the sharp waste container. A record of the medication administration will be made in the medical documentation with full patient identification. The insulin dose is prescribed based on the measured blood glucose glycemia level. For the proper effect of the dose, it is important that the insulin is administered into subcutaneous fatty tissue, not into the muscle beneath it. When choosing the injection technique, the location, type of insulin, body composition, and length of the injection needle should be considered. The absorption rate is influenced by the injection site, body composition, and blood circulation in the tissues.